Hello, social workers, mental health professionals, and change agents. Welcome to another episode of season 6 of the Social Work Rants podcast. I'm your host, Bash Moreno. Saludos a todos. Greetings, everybody. Thank you for tuning in, tapping in wherever you are watching or listening to this podcast. Thank you again so much for your love and support. Gracias a todos por su apoyo. Ranked number 9 according to FeedSpot or Social Work Podcast. So that's you, the listeners. That's you, the viewers, for resonating to what I'm trying to say, what I bring to the table in terms of the social work profession and my version of giving back to the social work profession uh, with our code of ethics by doing the podcast. So, and things that are not normally talked about in our profession. So again, thank you so much. Follow the podcast on Instagram at the Social Work Rants Podcast. That is all one word. Follow the podcast on Twitter at Social Work Rants and hit the like button. Type in the Social Work Rants Podcast on Facebook, aka Meta. Hit that red subscribe button on the YouTube, and also on however you listen to podcasts. Rate the podcast, follow the podcast. However, these platforms, such as Apple, Spotify, wherever you listen to podcasts, make sure you follow and leave comments, reviews, or what do you think of these episodes. June 16th, Friday, June 16th, I am hosting my first webinar, financial webinar, the rebrand of my business, Bad City Entertainment. Just giving my why of wanting to do this, basically giving like my backstory in terms of things that I learned in the finance game in the last 3 years and kind of give back. So if you're interested, if you go to bassmoreno.com and get your tickets at $7 a person. So hope to see you there. My guest at this time had the pleasure of meeting this talented social worker at the National Social Work Conference on social work on HIV and AIDS in Washington D.C. recently. Gabriel Silva, how you doing, sir?
Good. How are you?
Good. Pleasure to have you on the podcast. So, how are things going?
They're going well. Just being a social worker, comes with the typical challenges, and so I my work kind of overlaps different areas. So I do direct practice, but also I'm in the administrative side.
Mm.
So it depends on which day it is. Today was a very productive day, I think. So yeah.
Okay, cool. For people who don't know who you are and what you do in our field of social work, let get a little backstory of who you are.
Yeah, I've been in the field for 10 years now. I guess I start with my work experience. Well, all my work experience has been in Georgia. So
Okay.
I went to school in Georgia, both my undergrad and my master's from University of Georgia. And then when I graduated with a master's, I went and worked in providing therapy for children in foster care for about a year. And then during that time, I had an opportunity to work in HIV, primarily because a peer of mine, a colleague of mine who graduated with me with my master's, was an intern at this particular agency and said, "Hey, they're looking for someone bilingual. Would you
Mm.
be interested?" And I was like, "Oh, I never thought about HIV. I don't know anything about HIV." Long story short, I applied, and here I am 10 years later, almost 10 years. So, I started as a medical case manager, doing a lot of, the typical case management duties, and then became a team lead. And now I've become the assistant director of client services, which is our department that, specializes in supportive programs, which includes obviously case management, housing, transportation, food resources, all those supportive programs that, if you work in HIV, you're familiar in.
Mm-hmm.
And then I also do private practice on the side, providing mental health support, primarily focusing on CBT as uh, my method of providing my therapeutic approach. So, and then in my direct practice, my private practice, I primarily focus on adults. So I don't work with children or teens.
I don't
So
blame you.
well, and I did it in the past, and
Right.
I enjoy the sessions, but it's kind of hard to do there for me
Uh-huh.
personally, doing therapy with children because you have to teach a lot of concepts before you really work really deep on the stuff you have to do. And then when foster care, you also have to deal with defects, the foster care parents,
Yes. Foster
you
care
know,
parent. Yep.
then the child sort of is getting mixed signals from
Hmm.
like I say something, then the foster parents say something, then the defect says something, then they're if they have contact with the biological parents, then they say other things. So it
Yes.
becomes very challenging. So it kind of, I was like, I can't do this, at least not in this population. And so I think with adults, even though some adults are not easy to work with,
Yes. That's
I
true.
think there's you know, I find it much easier. So yeah, with my private practice, I primarily with adults and in HIV, I think, primarily, we see it all. I always tell my interns with HIV doesn't discriminate against anyone. I mean,
Hmm.
we see it all. And our clinic is very diverse. So I've been very
Yes.
lucky to be exposed with many different patient stories and backgrounds. So
It's funny that just just a couple things we share something very very similar. I started in foster care
mm,
and did that for 3 years, and that I, I couldn't do it anyway anymore. And then I working in foster care was my first experience in HIV because I did have someone diagnosed with HIV, so it kind of springboarded like kind of like 2 jobs later. It's like, oh, I had somebody on my
yeah,
caseload. They're like, have you had any experience? Or like, I knew somebody. I had somebody on my caseload, but I didn't do the ins and outs. So like, I didn't know anything about T cells or viral load counts or how to look at that on a lab report or anything like that. So I learned that, but it was thanks to the foster care job that I even had that kind of like background of like, okay, I need to pay attention to is this person taking their medication and how their health doing, and not just only focusing on trying to get their kids back from the foster care system. So it was definitely more attention to detail with that case and more involved than just okay, comply with services. Let me do these referrals and see if you get your kid back, or we're gonna put the kid up for adoption. So it's definitely interesting. And you mentioned something that for the new social workers or those who are in school currently, you had somebody, and this was like probably like my biggest regret is you had somebody that you went to grad school with hook
mm,
you up with a job, and I can literally count on one hand, maybe both my hands, the number of people that I still have any sort of contact. Most of this like social media stuff that I have contact with people I went to grad school with. So it's kind of the importance of networking is so important, even within your own the grad school department. I mean, it starts in the grad school. Unless for myself, I started in the field working and then went back to school get my master's. So it's kind of for those in MSW programs and new social workers,
yeah,
keep
yeah.
those
And
keep those contacts.
yeah, and it's funny because our cohort for my master's was 90, I think, it was around 90 people, which is pretty
Mm,
large for a 2-year master's program. But so we were one of the largest. And we were split between a clinical concentration versus a macro
mm,
community concentration. And this particular friend was in the macro concentration. So we only had classes together that first year. And then the second year, she was doing all the macro community
Mm,
classes, and I was in the clinical classes. But we just kept in touch. And then she was placed at this agency,
mm,
clinical HIV work as her foundation year. And even though she said, I don't work with people, I don't want to work with people, they were like, no, you have to. So they put her there. And then if
right,
she hadn't pursued it, or I probably wouldn't have had the job. I wouldn't have known. So I think it all happens for a reason. And
yes,
we still keep in contact. So and now she works in she does a lot of voting outreach
okay.
and fighting voting suppression in Georgia. So
Which is a very big deal, especially these last like at least 4 years.
right. And then when I first started, I wanted to do therapy. Like I wasn't thinking about, doing case management or any of that. So I think it all comes down to how flexible it is to have, not to have, but to be a social worker. Like because we're trained to do all these, we're trained to be everywhere,
Right,
basically. We're trained to have a lot of skills, so you can put us in different settings and we're going to be effective. So you can be a
right.
therapist, you can be a medical social worker, you can put us in the hospital, a prison, you can do voting outreach, you can do advocacy, policy work. Like I
Mm,
think that's one of the reasons why I gravitated to the degree, because like, okay, if I get tired of therapy, I can do something else, or vice versa. Like
right.
so, um
No, absolutely. And I'm still learning about how our skills are transferable into other areas. In fact, I wanted to do for a while. I wanted to do mental health therapy, and then like got paid to do it for a couple of years, and like, okay, this is not for me. I needed to either go back to the case management or do something else. So, definitely for new social workers or those in the program to try anything. Just don't just get your feet in the door, get paid, and you got other skill sets for side hustles. Do that. But I want to touch on like I said, we met at the conference, and your great presentation really struck a chord uh, with me in a positive way. Have a lot of uh, immigrants, newly immigrants, and you mentioned a word that I forgot the word that we say documented, but you use
unauthorized. Yeah.
unauthorized,
Yeah.
and I love that, and I think I want to start using that, and start getting the practice of using that terminology, especially undocumented, all this back and forth. The racists using like illegals and all
Well,
this. That's
yeah, because this touches on labels, right?
yeah,
And what those labels represent and what perceptions we have when we hear certain words like illegal or like undocumented or like alien. I think someone
mm,
said
yeah,
in the presentation, like alien is another word, like, because it means you're a stranger, you don't belong here. So, I think, kind of switching our language. Um, that's more empowering and less negative can
right.
have a positive effect in our work, but also a positive effect for the people that we serve.
No, absolutely, and the population that we work in is already enough stigma in terms of HIV. Then you add that, especially in our Latino Latinx communities, is like this extra stigma on top of that, and then add to many are newly entering the country within the last 3 or 4 years, and then have a new HIV diagnosis, or they coming in not knowing like their status, and then they come here with better health care, and then they find out they're HIV, or they like straight up full blown AIDS diagnosis because their under T cells are under 200, and then their viral loads in like thousands or even like 10,000 plus. So it's like all these different dynamics, these layers on the layers, and where I work as a lot of Latino population, a lot of Haitian population as well, and people coming in. either newly diagnosed or been diagnosed for a while and like trying to get treatment. And like we mentioned, the barriers of the language barrier, the transportation is such a huge barrier. And it's funny, it doesn't matter who I talk to, no matter what state, the two main themes, and I brought it up on a recent podcast episode, my recap of the conference was housing and transportation. I could be working in Georgia, in Georgia, or there was a lot of people from Michigan. There was a lot of people in Texas there, and I could have worked at those states and still be dealing with the same issues and vice versa. So
Yeah.
it was fascinating to see, interesting to really kind of see where how things are at. What was your impression overall, and let the viewers and listeners know about your talk at your presentation at the conference.
My like how I felt after.
Yeah, how to felt out. How do felt afterwards? You talk a little bit about what you discussed at the conference, just to give like some context.
Yeah, so my presentation this year was, focusing primarily on our Latino, Hispanic, Latinx migrant population because it's a very specific subgroup
Mm-hmm.
that doesn't get a lot of attention. And when they do get attention, it's usually in a negative way, I
Mm-hmm.
find, especially in media. So I wanted to, you know, in a social work conference, obviously, we work with very diverse populations and, a lot of populations that are, disadvantaged,
Mm-hmm.
right? And a lot of populations that may be oppressed or are oppressed. So I wanted to make sure that there was a light on this particular community. Yes, I could have done a whole hour. I could have done a whole presentation on just a broad Latino, Hispanic, Latinx, but that would have been that would have been a whole day thing or two,
Yes,
right?
at
Um,
least.
but so I wanted to specifically focus on this population because it is a very challenging population. There are a lot of barriers. So I talked about those barriers. I talked about those challenges. I talked about the trends, right? Because outside of HIV or outside of social work, feel like I find that people tend to have an idea or a perception like, oh, these are what immigrants look like,
Mm-hmm.
or how they come in here, or what they're doing. Like there's this perception of they're here doing crazy things, right? Right.
Mm-hmm.
So I wanted to make sure that I utilize facts to educate people like, no, actually, this is what the research says, or this is what the numbers look like, or this is, I kind of want to, start off my presentation that way. And I wanted to talk, obviously, now that I've talked about the facts, the trends, the barriers, like its impact on HIV and HIV care, right? Because, um, you mentioned transportation and housing. If that's not addressed or handled, that does impact
Mm-hmm.
your HIV care, or how you navigate through your HIV care or your medical care, or how or what your social workers need to do, right? Sometimes there are no resources for housing or transportation. You kind of have to problem solve. Okay, what am I going to do?
Mm-hmm.
And towards the end of my presentation, I talked about different strategies, like about the knowledge that social workers should consider when working with this population. Like you need to educate yourself about, especially in your area, you know, what that looks like, the migration, or what that community looks like in your area. Like I know in at the Atlanta area, we have a high concentration of Mexicans, and Venezuelans, a lot of Central Americans. There's pockets of that, Colombians. And then I talked to someone from Florida who has a lot of obviously Cubans and Puerto Ricans.
Mm-hmm.
I talked to a lady from Michigan that, a lot of Dominicans in
Mm-hmm.
that area. And so, kind of knowing that around you, like, okay, because that then develops that cultural humility and awareness. Like, okay, I
Right.
know community. So I wanted to talk about that. And then I wanted to talk about strategies, right? We mentioned earlier about labels,
Mm-hmm.
being aware of those labels that you use, or the stereotypes.
Right.
And being sensitive about, communication, right? Because not saying all migrants can't speak English, but for the most part, a significant portion don't speak English very well, or they don't speak at all. So making sure that, we're trying to put things in place to accommodate that, or to
Mm.
help, help them navigate their care much effectively.
Right.
Then, obviously, since I work in mental health, I wanted to talk about strategies more specific to mental health. I could have done a whole thing on that,
Yeah.
but, I just wanted to kind of introduce what I found in the research that has been effective for this community. And then obviously research. I wanted to talk more about, if there's research geeks out there, about what we can do better to ensure that we're getting the appropriate studies, you know, uh, that we're evaluating what we're doing is, like, whether or not what we're doing now is working.
Right.
So, also the research piece, because, I think one of my points, and I don't care if I talked about it or not, that, a lot of the research and numbers have been primarily focused on male migrants,
Mm.
especially from the 80s and 90s when there was a huge influx.
Right.
But we've seen now an increase on female
Right.
migrants,
Mm.
children.
Mm-hmm.
And so now we're only just kind of guessing or estimating what those numbers look like in terms of HIV, or in terms of barriers, or all these other things that affect this population. So, that's a perfect example of, like, we need more research for them now, because we're seeing an increase on that, right? And then the other thing is that a lot of migrants, they're not a lot, but there's a significant portion that come here and then leave. Then they go back, right? And so they're not here to stay permanently.
Right.
But again, there's, all of that is education, all of that is
Mm.
about research. And so that's pretty much in essence what I presented on. That,
I,
and I kind of wanted to, maybe, for some people, maybe it was like a brand new thing for them. For some people, it's like, oh, I already knew this stuff, but I didn't know this, right? So I'm
yeah,
pretty sure,
you can't assume.
right? I'm pretty sure my presentation could be broken up in different pieces, and I could definitely elaborate more. But
Mm.
for 75 minutes, you can only talk so much.
No, exactly. How did you feel afterwards once it was done?
Well, I felt relieved, but also felt um that when people came talk to me in the questions and the comments, it felt validating that people connected with what I was saying. They felt connected to some of the stories that people were sharing, because I think everyone understood, like, oh, I've been there.
Mm.
Oh, I've had a client like that.
Mm.
I think being in that collective room where everyone's sharing, and I think everyone was saying, like, well, try this or try that, or this is what I've done. And
Mm.
I think that
Mm.
was, I think, helpful. And even for me, I
Yeah.
think I think I learned some things from, like, oh, okay, well, that makes sense. Like, I never considered that. And also consider that some states have better resources than others. So,
Yeah, absolutely.
I'll take into consideration that. So, I think it went well, and I was, nervous because I had all my notes in my written down, and I never once looked at them. So I think it went well. So I felt pretty confident.
For a social worker who wants to get into doing presentations at like a prestigious, conference, what was the process, when you submitted it and being selected? Like, describe that whole process in case somebody actually wants to
Yeah.
get into conferencing.
Well, this is my fifth time presenting at a national conference, I believe. I can't remember now. This is my second or third time at the social work. Yeah, my third time at this particular conference. The first two times were virtual because of COVID.
Mm.
And then I presented at the National Latinx Conference on HIV last year. And then I presented at the Ryan White Conference last year
Mm.
virtually. So the process is, so I say that because the process has been similar for all those conferences. They give you a template, sort of like, this is our theme. These are the kind of things that we're looking for, the kind of topics, or the focus areas that we would like to hear more about. So based on that, I thought about last year. This particular conference was in New Orleans last year, and
Okay.
I thought of like, well, there weren't. I don't think I ever saw anything that talked about the Latino Hispanic community, and based on their their focus area, I wanted to focus on that population and kind of take a clinical approach to it. So once I had that idea, I needed to find the research. I needed to find like, okay, if I have this idea of, and kind of and want to present the facts, like I was saying earlier, and kind of present strategies, like I gotta back up what I'm saying, right?
Mm-hmm.
So I had to go into the scholarly world and find articles to back up my data or my hypothesis, basically.
Right.
So that took the longest, is finding articles that supported what I was saying, or articles that maybe gave me a different perspective, like, oh, actually, group cognitive behavioral therapy is very effective for the Latino Hispanic community. And I was like, oh, I didn't know that. But that definitely backs up something that I can use, because that's an intervention that social workers can use, for example.
Yeah.
Or finding an article that talked about the HIV trends, where most migrants test positive after migrating to the US, or they contract HIV after migrating to the US. So that was something I didn't know. So having that knowledge and that research, kind of helped me formalize an abstract
Mm-hmm.
that made sense, that was easily backed up. And obviously, part of your submission of the abstract is also submitting your references. Like, okay, well, you're saying all this. Can you back it up? Well, yes, I can. So here's a list of references. And then, I guess, and I was part of the program community last year.
Okay.
So I was the one reviewing abstracts and kind of scoring them. So that process, I don't know what it looked like this year, but essentially, I think you would just, they would get the abstracts, they score them, and then based on the highest score, they will select an abstract that would be selected for the conference. So I got the email and I'm like, okay, well, now I have to really work on this, right? Now thankfully, I had all my articles, so my research. Now I have to elaborate on it. I have to elongate that, and make it into a presentation that's cohesive. And
Mm-hmm.
that probably took the longest, is just, taking that data,
Right.
those facts, and kind of putting it in, organizing it, and put it into a more, into a presentation, well, to put it into words that people can understand, right?
Yeah.
I don't want to just plaster a bunch of words into a
Right.
slide and be like, here you go, or just read from it, because that's not really, I don't learn. I mean, for me, I don't learn from presenters that just read from their slides. Like, I like to just put the main points and then discuss, like, okay, well, this is what it means. Here are the main things. Here are the
Right.
main, the bullet points, and let's talk about it, right? Or let me educate you on these bullet points. So, I think, and it's funny because I'm not a public speaker. I mean, that's not, I'm not
You
good
could
at.
you could have fooled me.
But this is what I think, I think, and I think I've had it, well, not I think, I've had conversations with colleagues where, if, especially with social workers, if we don't see something happening, sometimes it's up to us to do them.
To make it happen, right?
Right. And so, like that example, like I didn't see some of these things that I wanted to learn about last year. So I was like, well, I'm not gonna wait for someone to do it. Like, I can go ahead and do it. I know this population, and I presented before, like, let me go ahead and do it. And hopefully they'll like what I have to say. And they did, right? And so I think that motivated me, because if no one else was talking about it,
Mm-hmm.
I mean, this population kind of doesn't get the attention it needs. So I think
No.
that motivated me. And then if you're confident about the topic, you forget those nerves. You forget that you're
Yeah.
like, "Oh, okay, well, that's not a big deal." I think if you're passionate about something,
Mm.
that supersedes all the
Right.
other nerves that you may be experiencing.
No, yeah. And I want to go back real quick to like the language, and I know when I was doing school social work, I know like you mentioned like pockets of communities. So where in the town that I live in, there was a lot of well, I saw a lot of people from Guatemala and Venezuelans moving in. Um, so there was several people who couldn't not only read or write in English, but they couldn't read or write in Spanish. So so this is like 2001, still like not
Yeah,
even like a full year into the pandemic, and like I basically forced to do home visits to people's homes to let people know, parents know what the district is doing in terms of like just stuff they were doing, like meals for families or just anything that the district was doing for families. And like, oh, by the way, like there's a summer program that you might put your kid in, and so like this is the registration, this how to do all that and do these extra home visits, just because like, okay, you're sending emails, great, it's in English and in Spanish, but it didn't resonate to the population I was assigned to. So like,
right,
that's kind of important too, like not assuming that you're still going to see results. You just there's still that language barrier, and you mentioned no dialects too play a big part as well.
right. And I think you know, uh, which could have been a bigger conversation about how the Latino Hispanic community is not this homogeneous community. It's
Mm,
very like within our community is very diverse, right? You
mm,
have the different dialects, for example, right? You have and I think someone in the conference even talked about like, well, not everyone in Latin America speaks Spanish either, right? Like it could be also indigenous languages
mm,
that and they may be from Mexico but don't speak Spanish,
right.
right? And then we talked about the values and beliefs that may be specific to each country or each area. Even food, for example,
Yes.
right? Food is very different. Like it's something that I may think like, oh, it's a torta in Mexico, might be something different in Puerto Rico, where their torta is going to be something that I did not expect what it was, right?
Mm,
So I think a lot of people, what I would like for, I guess, people in general is to understand, like, you can't just paint this brush and like,
yes.
okay, it's all the same, right? You have to take down and consider, like, okay, who's sitting in front of me? Where are they from? Like
Right.
let me understand this person specifically, not assume.
Yes.
Well, my last patient from Cuba, he likes to talk about his feelings, but maybe this particular patient from Mexico is like, well, we don't do that, right? I mean, I know it's a silly example, but
Yeah,
like,
yeah.
I think you
But
just
those generalizations, they really do exist. So
right, right, yeah. So I wanted to touch on that, which I think again, that's probably a separate
mm,
section in and of itself.
no, yeah, we could have like a whole conversation about that, and just that'd be a whole separate presentation with like. But I feel like I haven't looked at much research articles recently, but I know just seeing peers who are in research or had to do research for presentations and stuff like that. I noticed that there's not enough like black and brown in general doing the research. So how can you like research about us and come up with conclusions and but not really know us? And so and I even seen like memes and seen stuff like on Twitter or Instagram about even like the DSM-5. Like, there's not that many black and brown folks who like wrote stuff in the DSM-5. So how can you come up with diagnosis or
It's a good point.
fair like appropriate, culturally competent diagnosis for someone if like you're not in our culture or really know like our backgrounds and our customs and stuff like that. So it just needs to be more of us in these
Yeah,
spaces.
yeah. I mean, that you made a good point because if we're gonna like we want to make sure that whatever if we're gonna implement any program or intervention that it is culturally sensitive, but if it's gonna be but you don't want it to be culturally sensitive coming from a perspective that doesn't really understand that culture, right?
Yeah.
So yeah, I mean, I think a lot of the research that I found, yeah, I think it was half and half. Like half of it really did come from our community, and the other half was just wanting to research this community. So yeah, I do think that we need to put ourselves out there. So if there are any research geeks out there that are part of the Latinx community, go for it. I mean, we need that. I like research, but doing research is very different. So I think you made a really good point on that. Um,
Now, in your private practice work, what are themes that you're seeing in with the patients that you're seeing?
so in private practice, well, I would say since COVID, I mean, anxiety is the number one thing that I see. I mean, it's just so prevalent now, and and I think you know uh, that's number one. Depression, I think it is very present as well,
Mhm.
but anxiety seems to be the most common thing that I see. Almost 80% of the clients that I see is anxiety, not able to handle those intrusive thoughts that they're experiencing, or just kind of expecting the worst all the time, or
Mhm.
anticipating something bad's going to happen. I see that a lot. um and besides anxiety and depression, the other thing that I see is interpersonal relationship or interpersonal issues.
Mhm.
So relationship concerns with partner, which touches on like communication piece, uh, you know, have not being able to communicate with each other effectively. I see that a lot. And just yesterday, I mean, 5 clients back to back talked about that,
Mhm.
not able to express their feelings with their partner.
Mhm.
And it's sort of like, well, and I think some of my clients and I were talking about this. It might be generational, where we don't talk when you come from a family that doesn't talk about feelings, or that wasn't emphasized or normalized. Then when you grow older and you get into relationships,
Mhm.
then it's kind of like, well, I feel very uncomfortable talking about my feelings, or we don't do that.
Yeah.
And then sometimes you have a partner that's the complete opposite. They're totally open with their
Mhm.
feelings and very expressive, and that's where the conflict comes. It's like, well, I can't be that way, or why are you like that, right? And so those are the main things that I see in private practice.
Now you say generational thing. You think like social media's played a part in that, or is
Well,
just
I think and a client of mine was actually trying to figure out what that was. Like he was saying, like from millennials, Generation X, and boomers, that was the thing. Like you grew up not talking about your feelings. It was just like
Mhm.
either get over it or just internalize it, right?
Mhm.
Whereas I think younger people, because of the exposure of social media, more or that has become more normalized to talk about your feelings. I think some of the younger generation is more likely to tell you what they're feeling and why they're feeling it, or they're going to tell you what you did, right? Not everyone, but
Right.
for I think we're seeing that. And I see some of my younger clients, they will tell me exactly what they're feeling. I don't have to ask. Or they'll tell me something that bothers them. And it's like, oh, really? I didn't even know you were experiencing that, right? They just
Mhm.
unprompted will tell me. So I think when I say that generation, I think maybe hopefully, and which is good that we're seeing a change.
Right.
But I think with social media, I think there's so much content out there about, you know, from therapists or experts about mental health,
Mhm.
emotional health, feelings, that I think maybe that resonates with a lot of younger people. And I think it's like, wait a minute, it's not so bad feeling, it's not bad feeling angry, or it's not a bad thing when I'm feeling sad, or it's okay to cry, right? And I think as you get older and older, you're like, well, I'm not gonna cry in front of everyone. So I think maybe that does play a role, because social media is something that really exploded in the last, what, 15 years.
Yeah.
So maybe that does play a role in that.
But I was thinking in terms of communication, in terms of like everything is like shorthand, like through text messaging
Well, yeah, and so
and emojis to
right,
actually to like talk about actual feelings is like kind
which is, yeah. And
eh,
so on the
eh,
opposite end, but then you have a younger generation that's not really communicating effectively, whereas some of our older clients, they're more likely to talk to you in person and say like, instead of like, I'm gonna pick up my phone and text you. So now, so in that sense, yes, I see the opposite, where the younger generation is not talking as
mm,
much as they need, or they're not talking as much, but they're not communicating in person when they need to. I've had clients tell me about issues they've had with friends or with girlfriends or boyfriends, and I asked them, so how do you communicate this? And I'm like, oh, through a text or through Facebook Messenger or to Instagram Messenger, and I'm like, well, that's not a very effective way to communicate what you're. I mean, I'm glad that you're expressing what you're feeling, but through a text, that person may not really understand the tone,
mm. Tone,
or
context.
they're pissed off, like, oh, she sent me this text and blah 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 this, and I'm like, well, you're in, assuming,
Right. You're internalizing it or
or yeah, you're projecting
yeah.
something onto it, and then now you're upset, instead of, you could have picked up the phone, talk to this person, or you could have set
Right.
up a time to talk about this thing. So I do see that opposite effect now, where like my younger patients are like, they're more likely to text, they're more likely to use social media to communicate,
Mm,
but they're more likely to tell you what's happening.
right.
So it's a very weird
Yeah.
era to be in, I guess, in mental health, where I'll see like a 40-year-old versus a 20-year-old, and like the differences, like there are positive things that there are good things that my 40-year-old client is doing. Is like, okay, but these are the things that we need to work on, and then my younger client is like, oh wait, this is the other thing we need to work on. So it's very interesting
Mm.
seeing these changes where, and I don't know if COVID also
Yeah,
made.
I think for some reason COVID just did a number of people's communication skills. It just went
Yeah, because
down like real
yeah,
fast.
right. And I think maybe for some people, because of COVID, everything was shut down for some longer than others. That they just got used to that comfort of like, well, I can text this person, or I can call. I don't have to see this person to tell them how I'm feeling, or I don't have
Mm,
to tell this person what's wrong with me, because I can just send them in a message, right? So maybe that also opened up, that made it more difficult to communicate more effectively, because like I was saying earlier, like that communication piece is so common that I see it in almost my clients when they're in a partner relationship, or when they're married, or with friends, or when they're dating. It's like, why is this not working? And then when we talk about it, like, oh, it's because you're not communicating effectively, you're not communicating assertively.
right.
So yeah, a lot of layers.
Yes, a lot of layers. Uh, that's actually a good, a pretty good title for this episode. A lot of
Yeah.
um, so you're in Georgia, and Georgia has been the U.S. political spotlight at least definitely the last like 4 or 5 years. Big Senate races, you know, governor, election and voter suppression that's happening. Almost like Atlanta versus like the rest of the state of Georgia. A lot of dynamics happening in the Peach State. How, I don't know. I mean, I see voter suppression is definitely a social work, a huge social work issue. If we clients that we've seen, and we should be talking about having patients or clients or they registered to vote, and because a lot of their rights are being taken away, a lot of like basic needs like Medicaid and food stamps being taken away, or at least like talks are taken away constantly. Mentioned at the conference about Medicaid, the lack of Medicaid expansion, which is another barrier to resources in our field for our patients. So a lot of that stuff is happening in Georgia. So what are you kind of seeing like that we're not hearing about from like national media?
Well, all of that is correct. And I think the one thing that's more recent is the Medicaid now. There's this, I wish I could pull up the article, but there was it was on NPR that my boss, my supervisor has sent that Georgia's going to crack down on Medicaid. And there's a potential that a lot of our patients or just a lot of people on Medicare are going to lose their Medicaid, which is a huge barrier in and of itself. It's like,
Yes.
well, if someone doesn't have, if Medicaid is the way they're able to get their care, now you're going to make it harder for them to either get Medicaid, stay on Medicaid, or just to get medical care in general, right?
Mm-hmm.
So we're seeing that now. So that that's probably, I mean, that's going to be a challenge.
Yeah. Well, that's really ever since Biden canceled the national the COVID emergency, and I did a whole episode about this, the importance of us, caring about because it's gonna people have to like renew their Medicaid, and there's a lot of people who are overqualified for Medicaid are going to be cut off, and a lot of people that just made the cutoff or just whatever. I even seen like unauthorized, to use your words, some unauthorized patients actually get full Medicaid. I don't know how they did that, but that does happen from time to time. Government agencies, whatever they do, and people who shouldn't get Medicaid. So there's a lot of stuff that's happening. So yeah, you're right. It's a huge barrier. It's a huge concern. No, we where I work at, that's definitely we seeing that. I think I had a client another day had his possibly had his Medicaid cut off without him even realize it was cut off, and like never got noticed that he was due for recertification. So it is happening, and I wish it was more talked about more, not only nationally but locally as well. Like, all right, that the COVID national COVID emergency is over. Okay, like what does that actually mean? And they kind of like people are not talking about it.
Yeah, and then the other thing that I guess the other recent thing that I guess is very local is this quote unquote cop city is what they're calling it here. Is this, this new training center for the police to train. And so some of them are calling it, a cop city because it's just meant to, some people are seeing it as a way to equip police with more forceful strategies to police. And then I guess the other issue is that I think they got millions and millions of dollars from the city to fund this.
Hmm.
So a lot of people that are opposed to this are like, these funds could have been used for other things like housing, like mental health programs, like drug use or treatment programs. that is probably why people turn to crime, right? And so, now you're funding this where you could fund all these sort of programs that can help, that can provide people with a safety net.
Right.
So, that's that. I don't know if you just Google it, that's probably something that it was just approved yesterday. And I don't know what that's going to look like, but that's a lot of money that I feel like as a social worker should have been used for those things. And like we need better mental health programs here in Georgia, because housing programs that are underfunded. Housing here in Atlanta is crazy. Like
Oof.
no, and
It's
it's sad because a lot of people that are on limited income or living paycheck by paycheck are having to move out further out and out of the
mhm.
city, further and further, which most people, if you work in the city, you're moving forward, and then we don't have transportation or adequate transportation. How do you
Mm.
get there? It's just
Yeah.
it's mind-boggling, like some of these tactics, and I always feel like politicians should be social workers. That's like, because I think that when you're trying to pass these laws, you need to look at the big picture. And so
Hmm.
sometimes I feel like, the people making these laws should be social workers. And so that's, I guess, another thing that I'm, here in Georgia specific is this new training center
Yeah, I
that
heard something about that. So it
got
finally
approved.
passed. Who
Yeah.
who who? And this is in Atlanta.
Yeah. Yes.
Interesting.
Yeah.
Who's the mayor now? 'Cause I know Keisha
Andrew
Bottoms.
Andrew Dickens. So this is his second year, I believe. I think time flies, so I think this is his second year. But yeah, he seems to be in support of it. So um, I mean, again, I think when we got to think of when we look at the big picture, we got to think like how one thing affects the other, right?
Right,
Like so,
absolutely.
supporters of this training center could be like, well, we need to cut down the crime. It's like, okay, yeah, we need to cut down the crime, but then we also have to think about like, why are people committing crime, right? Like, it's not someone. I mean, most people are not just waking up out of nowhere and be like, today I'm gonna go and rob a bank.
Right.
There's something that led up to that decision, right? Like,
Hmm.
I don't have money, I'm struggling, I have kids to feed, or like the struggle is real, or someone's out to get
Hmm.
me, whatever that is. Like,
Right.
there's always something behind that decision making. So, you know, I yeah, I mean, I could
Yeah.
talk about that for
No,
sure.
it's so true that it could be anything. People are really struggling. COVID just made things worse. And people were already struggling before COVID, so pandemic came, and things have not really gotten any better. And I see more people going to be losing their housing. We're seeing the beginning effects of like Medicaid being affected, and we're doing a lot of Affordable Care Act enrollments. We see that as like the next option for people, and unfortunately, people are not going to be qualified for that either. So it's going to be a trickle down effect on care, and politicians cutting all these services, but yet it's funny because they did all this thing about the budget and all this stuff, but yet they cut all these major programs and funding. You're just going to be adding to the debt because people are going to, you cut all this stuff and people are going to get sicker, which is going to cost you more money in the long run. So things just don't make sense from what these politicians are doing.
Yeah, and also like they like how they, it's funny because all these politicians have a safety net, right? They have insurance, they
Mhm.
make, I think they have six-figure incomes that they earn,
Mhm.
and they have, they have all these benefits that they get, but then the people that they serve, they don't have those same benefits. So it's like, how are you to tell me that you don't like, you're not going to prove this. How are you going to tell me this is not needed when you yourself are sitting very pretty in your
Exactly.
office, like, oh, I don't have to worry about these things. So, it's just, you know, that's why I think like social workers should be politicians, like, because, I feel like we have a better sense of like people's needs, right? And so it's just, it's so striking to me seeing these politicians making justifications to why they support certain things, and it's like,
Yeah.
how, what do you really know about living paycheck to paycheck?
Yeah. Exactly.
Yeah.
It's yeah.
Or being without insurance.
Yeah. Exactly. And yeah, it's these governors like like Kemp and got DeSantis and
Abbott, Texas.
Tennessee, Abbott. The list goes on. And we got senators like who are social workers like Kristen Cinema doing a terrible job in Arizona.
Yeah,
So it's
well, if she is a social worker, we can't claim her.
yeah, we definitely don't claim her, but a disgrace to the profession. So it's things are happening, and we in the profession need to take on responsibility and learn exactly what's going on, because I've had conversations with social workers like, oh, I don't listen, I don't watch the news, I don't get into politics or this and that, but it's like that's where the education is going to come in, or like stuff is happening, and then like you're a private practice and your client is struggling, or the client can't come to see you because the client can't afford to see you, or the client lost insurance, so they can't see you. Like, then you're wondering why. Like, okay, turn on the TV, watch your local news, or watch like national news for a couple minutes, or follow certain people, who you feel like are trustworthy, and follow what they're talking about on social media, and get your news that way. Or MP,
Right.
mentioned NPR earlier, and then just Google, download NPR on your phone and kind of get the highlights of what's happening nationally. There you go. It only take like 20 minutes, and there you go. The less breaking news happens. That's different. So we gotta pay attention, because stuff is happening literally on a day-to-day basis. Things been happening every day that affects social work. Basically, like the last like seemed like 5 or 6 years already, even like before the 2016 election. So it's like these are constantly happening and affects us day in, day out, and we got to pay attention, because our clients are going to be, not only our clients going to be struggling, but we are going to be struggling, and we already in a profession full of burnout, and be like, why are we burnt out? Because all this stuff is happening and we not,
Right.
and we only could do so much. We could do all the advocacy we want, but these laws are passed and making our jobs harder. There's only really so much stuff we could do.
Right. And that's a good point, because another example would be like telehealth, providing telehealth. You have to know the laws in your state about
Mm,
telehealth, providing telehealth services. If you're just, if COVID kind of excused that, some of that, you're like, oh, well, it's kind of an emergency, so we'll just,
yeah,
not some states, some states could be like, you need to be certified to
yeah. You
provide,
got to be licensed in the
or you
state.
can be licensed to provide telehealth, or you have to do a training before you can provide, right? Like, if you don't know this stuff, you could be breaking the law,
Mm,
right? Or you could be fined, or someone could report you, whatever that is, right? You have to
yeah,
know these things. You have to be aware of what your state is doing or your city is doing, so you kind of know, like, especially if you're serving that community, you got to know how policies and laws impact that community, because ultimately it's going to impact you as a social worker,
yeah.
right? Like the example we're talking about Medicaid, like, if we have all these people losing Medicaid, that's going to impact my work,
Mm,
because then we got to figure out what we're supposed to do with these patients. Like, obviously for HIV, like, okay, we need to get them on ADAP,
yeah,
right? But I think, yes, I agree that politics and the news can be very overwhelming and
Mm-hmm.
very draining. But like you said, you could kind of maybe do the highlights or kind of
Mm-hmm.
take little snippets of it every now and then, like or like I can take so much, but then give myself a boundary, like okay,
Mm-hmm.
that's it, no more after
Yeah, you
that.
have to give yourself a boundary. Absolutely.
Yeah,
But at least when you have like states like Florida, Georgia, Tennessee, Texas, you got like Arizona, even my home state in New York, where I'm from, even eventually, I think maybe even like next year, there's a Delaware is be having a new governor, or at least an election for a governor. Somebody just announced candidacy to be governor, and I'm already not crazy about that candidate already. So, is things are happening throughout the country. Kind of like just pay attention to what you're seeing, because it's
right.
going to somehow we hear about trickle down effect. The trickle down in terms of economics is going to be trickle down effects. It's going to affect social work as a profession.
Right. And I think some people may not watch the news or read all this stuff because of self-care. Like, oh, I can't
Mm,
take that. Right. I need to do self-care. That's too much. So if that's the case, okay, I get it. You have to take care of yourself. But also like if you're gonna do that, then you need to surround yourself with a support network that will alert you and tell you
mm,
like, okay, you need to be aware of this. Right. Also utilize your peers for information. Like, if you feel like that's a better route,
mm,
peers that may tell you or just like, hey, watch out for this, or like, hey, there's something, if you support with if you surround yourself with a network of peers that have your best interests, they'll tell you like, okay, you better beware, Medicaid stuff is happening. They're like, oh, wait a minute, what? And then you kind of know that from there. But so maybe also turning to your other peers can also be a source of information.
just go back to networking
Right.
and like meeting people at conferences. Even something simple as like I mentioned previous episodes on the podcast. Just use the hashtag social work Twitter. There's so many dope, amazing social workers in the space, and we not only just talk about social work, obviously we talk about other stuff and fun stuff like that. But you just meet people like online and kind of surround yourself with people who are smarter than you and have like knowledge and kind of finding out what's happening in different states without actually the nuts and bolts of like the actual news. So that's another option as well, or just the power of social media. And social media could, if you use it for a good purpose, you're not going to be dealing with like the nonsense that comes along with it.
Right. Yeah.
So where can people find you at?
Well, I don't have a professional social media. I'm not really on social media that much. But if people are interested in contacting me, obviously I have, you know, both my agency email where I work at and my private practice email. And I can provide those emails as well. I think, Gabriel at thriveandsucceed.org is my private practice email. And then people can contact me, because whether it's about HIV or about mental health or about anything relating to what I've talked about or what they may be interested in and connecting on, that's probably going to be the best email. But yeah, I'm not really on social media as we talked about earlier. But I think for me, that is a form of self care. Like sometimes it's just too much, and I take my news accordingly as
Mm-hmm,
needed. I have a network of peers, but also have a network of reputable resources that I use. Like, okay, what do I need to know? What do I need to know?
mm-hmm.
So that's what I
Awesome,
do.
cool, awesome. Thank you for this engaging conversation. It was good talking to you again. We could go on literally
I know.
a part two, part three, part four. This.
Perhaps, if we need to, just let me know. Just let me know ahead of a time if we need to do a part two. And but yeah, I mean, I think when we talk about these topics, you know, they could, I mean, we could, like you say, it could go on for hours, and some of them don't have easy resolutions.
No, absolutely.
Yeah. So
Thanks.
appreciate you having me here.
Appreciate you.
Okay.